Welcome to another video. This video includes 10 nursing practice questions to teach you how to master the NCLEX. At the end of the video, check out the description for studying resources and more. Practicing nursing questions frequently is the best way to pass many nursing exams. Now let's begin. Starting with question 1. A male client had a right below the knee amputation 4 days ago. His incision is healing well. He has gotten out of bed several times and sat at the side of the bed. Each time after returning to bed, he has experienced pain as if it were located in his right foot. Which nursing measure indicates the nurse has a thorough understanding of phantom pain and its management? Phantom pain is entirely in the client's mind. The client should be instructed that the pain is psychological and should not be treated. The basis for phantom pain may occur because the nerves still carry pain sensation to the brain even though the limb has been amputated. The pain is real, intense, and should be treated. The cause of phantom pain is unknown. The nurse should provide the client with support, promote sleep, and handle the injured limb smoothly and gently. Phantom pain is caused by trauma, spasms, and edema at the incisional site. It will decrease when postoperative edema decreases. It should be treated with non-narcotic medication whenever possible. The correct answer is the basis for phantom pain may occur because the nerves still carry pain sensation to the brain even though the limb has been amputated. The pain is real, intense, and should be treated. Phantom pain may be caused by nerves continuing to carry sensation to the brain even though the limb is removed. It is real, intense, and should be treated as ordinary pain would. A client has been admitted to the nursing unit with the diagnosis of severe anemia. She is slightly short of breath, has episodes of dizziness, and complains her heart sometimes feels like it will beat out of her chest. The physician has ordered her to receive 2 units of packed red blood cells. The most important nursing action to be taken is starting an 18-gauge IV infusion, having the consent form on the chart, administering the correct blood product to the correct client, transfusing the blood in a 2-hour time frame. The correct answer is administering the correct blood product to the correct client. Administering the correct blood product to the correct client will maintain physiological safety and minimize transfusion reactions. The nurse has been assigned a client who delivered a 6-pound lb, 12-ounce baby boy vaginally 40 minutes ago. The initial assessment of greatest importance for this client would be length of her labor, type of episiotomy, amount of IV fluid to be infused, character of the fundus. The correct answer is character of the fundus. Character of the fundus would be the priority nursing assessment because changes in uterine tone may identify possible postpartum hemorrhage. On the first postpartal day, a client tells the nurse that she has been changing her perineal pads every half hour because they are saturated with bright red vaginal drainage. When palpating the uterus, the nurse assesses that it is somewhat soft, 1 finger breadth above the umbilicus and midline. The nursing action to be taken is to gently massage the uterus until firm, express any clots, and note the amount and character of lochia. Catheterize the client and reassess the uterus. Begin IV fluids and administer oxytocic medication. Administer analgesics as ordered to relieve discomfort. The correct answer is gently massage the uterus until firm, express any clots, and note the amount and character of lochia. Gentle massage and expression of clots will let the fundus return to a state of firmness, allowing the uterus to function as the living ligature. A 19-year-old male client arrived via ambulance to the emergency room following a motorcycle accident. He is comatose. His face has evidence of dried blood. On assessment, the nurse notes an obvious injury to his left eye. The preferred positioning for a client with an obvious eye injury is reclining to control bleeding. Any position in which the client is comfortable. Side lying, either left or right. Sitting with head support. The correct answer is sitting with head support. A sitting position with the head supported will prevent further injury while allowing injury care to take place. A 32-year-old female client is being treated for Guillain-Barré syndrome. She complains of gradually increasing muscle weakness over the past several days. She has noticed an increased difficulty in ambulating and fell yesterday. When conducting a nursing assessment, which finding would indicate a need for immediate further evaluation? Complaints of a headache. Loss of superficial and deep tendon reflexes. Complaints of shortness of breath. Facial paralysis. The correct answer is complaints of shortness of breath. Complaints of shortness of breath must be further evaluated. 40% of all clients have some detectable respiratory weakness and should be prepared for a possible tracheostomy. Pneumonia is also a common complication of this syndrome. A male client was diagnosed 6 months ago with amyotrophic lateral sclerosis. The progression of the disease has been aggressive. He is unable to maintain his personal hygiene without assistance. Ambulation is most difficult, requiring him to use a wheelchair and rely on assistance for mobility. He recently has become severely dysphasic. Nursing interventions for dysphagia would be aimed toward prevention of loss of ability to speak and communicate effectively, aspiration and weight loss, secondary infection resulting from poor oral hygiene, drooling. The correct answer is aspiration and weight loss. Dysphagia is difficulty swallowing, which could result in aspiration of food and inability to eat, causing weight loss. A client was admitted to the hospital for a TURP. Within 48 hours of admission and 12 hours postoperatively, both the blood pressure and pulse increased. He became agitated, thought snakes were crawling on his arms and legs, and generally became unmanageable. He pulled out his IV and urinary catheter in attempt to rid himself of the snakes. He was sweating profusely. The admission nurse's notes indicated that the client admitted to having a few drinks now and then. He is probably experiencing which of the following? Major psychotic depression, delirium tremens, generalized anxiety disorder, adjustment disorder with mixed features. The correct answer is delirium tremens. Delirium tremens occur approximately on the second or third day following cessation or reduction of alcohol intake. Symptoms would be all those described in the situation. A 14-year-old client has a history of lying, stealing, and destruction of property. Personal items of peers have been found missing. After group therapy, a peer approaches the nurse to report that he has seen the 14-year-old with some of the missing items. The best response of the nurse is to request that he explain to the group why he took personal items from peers. Approach him when he is alone to inquire about his involvement in the incident. Imply to him that you doubt his involvement in the incident and request his denial. Confront him openly in group and request an apology. The correct answer is approach him when he is alone to inquire about his involvement in the incident. Anxiety and defensiveness are lessened if the individual is approached in this manner. The primary focus of nursing interventions for the child experiencing sickle cell crisis is aimed toward maintaining an adequate level of hydration, providing pain relief, preventing infection, oxygen therapy. The correct answer is maintaining an adequate level of hydration. Maintaining the hydration level is the focus for nursing intervention because dehydration enhances the sickling process. Both oral and parenteral fluids are used. Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.